So let's talk about the mechanism of action of antipsychotics. So basically, we have a hypothesis, okay, a hypothesis which is called the dopamine hypothesis. Okay, so hypothesis is a very one of the most basic concepts in science. So we have a hypothesis, and then higher than that, we have a theory, and then only we have a law. Okay. So law examples is like Newton's law. Okay. And there are many other laws, but basically in medicine, I don't think we have a law. Okay. Sometimes we borrow laws from other disciplines. Okay, but basically usually what we have is we have many hypotheses. Okay, so hypothesis, and the plural is hypothesis, thesis. Okay, so hypothesis, as the word implies, means it's something quite theoretical. Okay, it's very basic, because we are unable to, it's unethical to dissect a person's brain. Okay, so we cannot just open up someone's brain. So it's unethical to do that. Okay, so what we can is, the closest we can get to it is to open up an animal's brain. Okay, and that's an animal, not a human, so it's not going to be the same exactly. Okay, so we can't really see what's going on to the level of details that we want so far. That's why we have hypotheses to try to explain things, why things are happening, especially in the brain. Okay, because the brain is very delicate and it's very sensitive area, so we can't just open up just like that. So we have the dopamine hypothesis that suggests, so the dopamine hypothesis of schizophrenia suggests that this disorder is caused by a relative excess of functional activity of the neurotransmitter dopamine. Okay, so we think that there is an excess activity of dopamine, okay, in the neuronal tracts in the brain. So what led to this hypothesis? Okay, what is the thing that underlies this hypothesis? Okay, number one is there are many antipsychotic drugs block the dopamine 2 receptors. Okay, so many of the drugs block dopamine 2 receptors. Okay, and they seem to work. They seem to work. They seem to control the symptoms. So that's one reason why this hypothesis is supported. Number two is that dopamine agonist, okay, dopamine agonist tend to exacerbate or make the schizophrenia worse. Okay, they tend to worsen the schizophrenia. So dopamine agonist worsens schizophrenia. Okay, dopamine agonist example is like amphetamine, and levodopa. So these two drugs, agonists, they tend to worsen the psychotic symptoms. Okay, so that's another plus it's another fact that supports the dopamine hypothesis. Okay, number 3 is that it has been detected in certain brain regions, okay, of patients who were untreated for their schizophrenia. We found increased density of dopamine receptors. So we found increased density of dopamine receptors, okay, in brain regions, okay, in brain regions of untreated patients with schizophrenia. So so these are points for the hypothesis. So what is against the hypothesis? Okay, mainly it's not fully satisfactory. Okay, this hypothesis is not that convincing in the sense that antipsychotic drugs are only effective partially, okay, in most patients. Okay, so they are not fully effective as we expect them to be. Okay, if this hypothesis is correct 100%, then we would expect like patients to be really their psychotic symptoms to be well controlled all the time, but that is not the case. Okay, and another thing that does not support this hypothesis is that there are many drugs that are effective for schizophrenia, okay, or for psychotic symptoms, but those drugs have a higher affinity for other receptors than the dopamine 2 receptors. Okay, so they have a higher affinity for other than the dopamine receptors. Okay, so these are the two factors that do not tend to support, okay, do not tend to support the hypothesis of dopamine, okay, the dopamine hypothesis of schizophrenia. And there are drugs, for example, like this is quite a classical stuff, okay, a chemical that used to be abused. I'm not sure whether people still abuse this drug in Malaysia or in other countries. So it's called phencyclidine, okay, phencyclidine, okay. This drug causes psychotic symptoms, okay, it causes psychosis, okay, people become crazy, sort of, okay, they act crazily, but then this drug does not, it has no effect on the dopamine 2 receptor, okay, dopamine receptors, nothing, okay, it doesn't cause any effect on the dopamine receptors. So this is another thing that does not support the hypothesis of dopamine hypothesis of schizophrenia. Okay, next, let's go to talk about the dopamine receptors. So far we have 5 that have been characterized. We have D1 to D5, okay? D1 to D5. And each of the receptor is a G protein couple receptor. So GPCR. And as GPCRs, they contain the 7 transmembrane domains, okay? 7 transmembrane domains, okay? The receptors are found in many places in the brain, such as the caudate putamen, the nucleus accumbens, the cortex, the cerebral cortex, and also the hypothalamus. So these are the places where the dopamine 2 receptors have been found. Okay, and they are the receptors are um, they are coupled to the adenylyl cyclase. Okay, it couples with the adenylyl cyclase. Okay, you can revise this the pictures of this. I'm sure you have seen it before, the GPCR. We have shown it to you previously. And the efficacy, okay, the efficacy of the older antipsychotic drugs usually will correlate with their relative affinity for the dopamine 2 receptors. Okay, so that's for the older ones. For the older antipsychotics. So for the older antipsychotics, the therapeutic efficacy will depend on the affinity for the dopamine receptors, okay, the D2 receptors. So the affinity for the D2 receptors, okay, will determine the therapeutic efficacy of the older antipsychotics. And of course, unfortunately, though, there is a correlation between the blockade of the dopamine 2 receptors and also the extrapyramidal dysfunction. Okay, extrapyramidal dysfunction. So whenever you talk about extrapyramidal dysfunction, we always think about Parkinsonism. Okay, Parkinsonism, and the triad of Parkinsonism: rigidity, bradykinesia, so they are slow to start their movements, and also tremors. Okay, so Parkinsonism, so they have a special kind of face. They have like a Parkinson's face. Okay, so the more you block the dopamine 2 receptor, the more severe you will see the extrapyramidal dysfunction. So let's talk about the other receptors. Okay. So as we have mentioned previously, most of the newer atypical antipsychotics, okay, most of the newer ones, they have a high affinity for receptors other than the dopamine 2 receptors. Okay. And many of the drugs have an alpha adrenoceptor blocking action that correlates well with the antipsychotic effect. Okay, so somehow blocking the alpha adrenoceptor, okay, when you block this, okay, you see a good correlation with the antipsychotic effects. And it seems that you can say that most phenothiazines and thioxanthines, thioridazine, haloperidol, clozapine, molindone, olanzapine, quetiapine, risperidone, ziprasidone, and aripiprazole, they all block the alpha receptors, okay, especially the alpha 1, okay, the alpha receptor. So there's a drug, okay, usually we use it only in resistant patients, okay, patients who when we give other drugs, they do not seem to work. So we tend to give them clozapine. Okay. So this drug has a significant D4 and also serotonin 2 blocking action. But it has almost no affinity for the dopamine 2 receptors. Okay, it doesn't bother. Okay, it's not bothered with the dopamine 2. Okay, so it has no effect. Okay, it has no effect here for the dopamine 2. No, okay, there is no effect. And most of the newer anti-atypical drugs, okay, for example, olanzapine, okay, then quetiapine, risperidone, they also have high affinity, okay, high affinity for the serotonin 2A receptors. And at the same time, they also may interact with the dopamine 2 and other receptors. For other new drugs, such as like ziprasidone, okay, ziprasidone. So this drug, it blocks the dopamine 2, the serotonin 2A, and also the serotonin 1D. But at the same time, it's an agonist, okay? It's an agonist at the serotonin 1A. Okay, if you're confused, okay, you can forget about this agonist effect, okay? Just try to remember that it blocks the dopamine 2, serotonin 2A, okay, serotonin 1D, okay? Once you have remembered that, then only you bother about its agonist effect on the serotonin 1A, okay? How do I get let's erase this 1A, okay? So you don't want to confuse you, okay? You can just remember that clozapine, it doesn't affect the dopamine 2. Okay, there's another drug called aripiprazole. Okay, aripiprazole. I'm not sure about the brands. Like 10 years ago, there used to be a brand called Abilify. I'm not sure whether there are many newer brands for this. Okay, so we used to have Abilify for this drug. So this one is a partial agonist. Okay, it's a partial agonist. So maybe I'll draw something like this: partial agonist at the D2 and 5-HT1A. But it's a strong antagonist. Okay, strong antagonist at the 5-HT2A receptors. So serotonin. Okay, so the focus is mainly on serotonin here. You can see blocks serotonin, serotonin, serotonin 2A, serotonin. Okay, that these are the main. This is the main feature of the other the newer antipsychotics, or the atypical antipsychotics. So, and these characteristics have led to an alternative hypothesis to the dopamine hypothesis. So, as you can guess, the name of the hypothesis is the serotonin hypothesis. Okay, serotonin hypothesis of schizophrenia. And one good thing about the newer drugs or the atypical drugs, okay, most of them they cause less, okay, extrapyramidal dysfunction. Okay, sometimes we tend to call it EPS, okay, extrapyramidal symptoms. Okay, so it causes less of EPS symptoms than the standard drugs. Um, and just to take note, okay, take note that you could say that all antipsychotic drugs block the histamine 1 histamine 1 receptors to some degree, except for the drug called haloperidol. Okay, it's a classical drug. Okay, it's an old drug. Okay, it's a typical antipsychotic. Okay, and that drug has no effect on the H1. Okay, no effect on the histamine 1 receptors. Okay, so we'll continue in the next video, talking about the effects of dopamine receptor blockade and other receptor blockades of the antipsychotics. Okay, that's all for now.